People often ask us in clinic, what's the best general exercise for health? And I usually refer to them to my top 3 tips, and which one is the most appropriate depends on where you are on the scale. And the first of the key tips is preserving your flexibility. Essentially, flexibility just means the ability to move through different ranges of motion, and it requires both the muscles, the tendons, and the joints and ligaments to be sufficiently flexible to allow you to move in whatever directions you want to be able to move. And usually, as time goes by, particularly into our 30s and 40s and beyond, our tissues become less elastic. So naturally, there's an increase in stiffness in the tissues. So unless we do something specific to try to counter that, then we lose flexibility. So oftentimes that's compounded by our lifestyles, where we may spend lots of time in fixed positions, sitting, driving, these kind of situations where we're not putting our tissues through full ranges of motion. So the tissues just gradually adapt over time. So when you take together the combination of fixed positions, work positions for long periods of time, aging tissues becoming less elastic, and not doing specific corrective things, all of this leads to a bit of a cocktail where the tissues just lose ranges of motion. And when that happens, then it's much easier to strain them or irritate them with movements that take them into zones that they're not normally in, and therefore that's a common cause of causing tissue irritation, which we would see clinically. So very often the treatment needs to be, first of all, to patch up the sore tissues, but to identify, well, why are those tissues under pressure? So lack of flexibility would be the first priority. Now, in general, females tend to be more flexible than males, and then there are some people who are particularly flexible, a condition known as hypermobility, and whilst they are very flexible, they're often more prone to injury, particularly if they don't do general exercise to keep the muscles stimulated, and we've talked about that in previous videos. So people who are excessively flexible obviously don't need to spend time working on flexibility, but for a large proportion of the population, particularly over the age of 35, 40, they need to be doing things to try and preserve flexibility. So that raises the question, well, what's the best way to do that? Some people enjoy a class kind of environment. So obviously something like yoga would be the best known of the flexibility kind of regimes, but it doesn't have to be a class. You can easily have a specific flexibility program tailored to your needs, and 20 minutes at home with no equipment 2 or 3 times a week will be quite sufficient to preserve and restore flexibility when there are deficits. So it really just depends on what suits best and what fits into your lifestyle. So usually to do that, if it's a home exercise program, it needs to be tailored to where your flexibility deficits are. Obviously, you don't need to be spending time on movements which don't challenge you. So it's about fine-tuning a regime to give you the best bang for your buck. So that's tip number 1, to work on flexibility. Tip number 2 is to make sure that your muscles are sufficiently strong to manage body weight. So we're not talking here necessarily about gym levels of strength and power. We're talking about sufficient strength to be able to manage your body weight in different positions that you may get into, whether that's bending forwards when you bend over to put your shoes and socks on, or pull a plug out of a socket. You need to be able to support the weight of your upper body, which typically would be 5 or 6 stone, or 40 or 50 kilos, and maybe more. So you need to have that sufficient strength, and if that isn't there, then it's much easier to cause a tissue strain or irritation of any of the structures in the lower spine. Something like getting up and down from a chair, or down from a low squat. If people are doing DIY or doing some gardening outside, you need sufficient leg strength to come from a full depth squat position up into standing. And people are often surprised how hard that can be. There's a big difference to coming up from standing from a full squat position as opposed to coming up from a chair where you're only bending halfway. Again, if people don't get into squat positions, they're often quite surprised or shocked how how hard it is for them to get up from those positions. And that may just simply be difficulty, which is a lack of strength, or it may be that they get pain in other areas, and that's either because there are sensitive tissues, or that the amount of effort that having to put in to get out of the position just puts other areas under pressure. So that's often a clue, and people will say to us, "Gosh, I was down doing some gardening at the weekend. At the weekend, now that spring is here, and they found it very hard or painful to come up from a squat position if they were down weeding." And it is a challenging position, and it'll expose any deficits in muscle strength. So that's, if you like, basic strength to be able to manage your body weight. And obviously, unless you do something specific to preserve your strength, then it tends to deteriorate. There's a statistic that we'll often share with patients, which is pretty shocking, and that's basically that we lose 1% of our muscle mass every year after the age of 40, unless we do something special to counteract that. So if you think about that and you're over 40, losing 1% of your muscle mass, very few people lose 1% of their body weight year after year. So what actually happens is that the muscle turns into more fatty tissue and less useful for generating power. So that's just one of the consequences of aging, and it means that you have to work that bit harder to preserve strength as you get a little bit older. On the other end of the scale, people who do a lot of gym activities and work on strength, usually one of the consequences of that over time is that they get progressively stiffer in certain areas because they're working the muscles maximally. And generally, again, for folks over 30, they need to concentrate a bit more on adding mobility work into their workouts or into separate training sessions to counter the effects of strengthening work. So the second tip would be maintaining and improving your muscle strength if there are deficits in that. And then the third tip would be to maintain your coordination and balance. And that's important. It is partly related to muscle strength. But muscles can be strong but not coordinated, and that again can predispose you to a risk of falls or transient losses of balance, which you can sprain ankles or knees and things like that. So they're probably the three fundamental things that I would say that you need to focus on. And of course, the key is which area is most relevant to you. Sometimes people need to focus on all three. Sometimes it's purely balance and coordination work, or sometimes it's just purely on strengthening work. And working on one doesn't necessarily help the other. So the key here is to identify what your deficits are in what region of the body, and then having a tailored approach to try to address that. So that tends to be a more long-winded answer to the question that people ask, but there are very few general sports other than gymnastics that would cover all of those bases all at one go. And obviously, other than kids and teenagers, there are not many folks who would do gymnastics as an activity, but that's probably top of the pile in terms of ticking all the boxes. So hope you enjoyed the video. I'll see you again on another one. Bye for now.